Good morning. I'm Dan Mazier, the Conservative Shadow Minister for Health, and I'm joined here with my colleagues from the Health Committee, Helena Konanz and Dr. Matt Strauss. A few weeks ago, we stood here and called on the Auditor General to investigate the $300 million PrescribeIT failure. Today, we're going a step further. My colleagues and I are here to announce that a Conservative government will end all federal funding to Canada Health Infoway. We will take any function worth keeping and move it inside Health Canada, where it answers to Parliament and where Canadians can see how their money is being spent. And let me say this before I go any further. We hope it doesn't take a Conservative government to do this. If the Health Minister wants to stand up tomorrow and announce she is defunding Canada Health Infoway, we will applaud her all the way. Most Canadians have never heard of Canada Health Infoway, so let me tell you who they are. Canada Health Infoway was created almost 25 years ago to help digitize health records. But under the Liberal mismanagement, it has become an unaccountable administrative middleman that spends millions on executives, consultants, conferences, and failed programs while Canadians wait for real improvements in healthcare. In its very first annual report back in 2002, Infoway made a promise to Canadians. It promised it would not become, and I quote, a large corporation. It promised to be a small group of healthcare information technology and change management specialists. That was the promise. But after a decade of Liberal mismanagement, Infoway has become exactly what it said it would never be. It has ballooned from 50 employees in 2003 to 175 employees today. This includes 6 senior executives, 24 vice presidents, and 89 managers. The CEO of Infoway is eligible for nearly $900,000 a year in total compensation, which includes a personal driver. This is an organization that lives almost entirely off of your tax dollars and that are provided by the federal government. You might forgive the excessive administration and executive costs if there were clear results, but there are none. And nowhere is Infoway's failure more clear than with PrescribeIT. Canadians know the story by now. PrescribeIT was supposed to be the flagship, the program that would finally eliminate the fax machines for prescription drugs. Instead, Infoway burned through $300 million. Nearly $100 million of that money was outsourced to TELUS Health. Another $167 million went to operations and overhead, which included $108 million in personnel costs. And while Canadians footed the bill, TELUS Health walked away with 85% of the intellectual property behind PrescribeIT, meaning taxpayers paid to build the technologies that they don't own. And what did Canadians get? At its very peak, PrescribeIT processed fewer than 5% of prescriptions in this country. Then it was shut down. If any CEO in the private sector was responsible for this level of failure, they would have been fired. But under the Liberals, former Infoway CEO was rewarded for his PrescribeIT failures. He was paid nearly $900,000 a year, which included a performance bonus of over $200,000. All indications suggest that the federal health minister's representative from Health Canada on the Infoway board voted to approve bonuses during PrescribeIT's failure. The only people who seem to benefit from Canada Health Infoway are lobbyists and consultants who profit from endless conferences and reports that produce no tangible benefit for Canadians. Excuse me. Lobbyists love Infoway because it means another conference to wine and dine at. None of that helps a single Canadian get their prescription filled or access to a family doctor. In just 3 years, Infoway spent $23 million on outside consultants and more than $400,000 on executive travel. Conservative on the Health Committee obtained former CEO Infoway's expenses. In June 2024, he traveled to Europe for a conference presentation, billing taxpayers more than $10,500 for that single trip. That fall, in October, He was in Asia at another conference, billing taxpayers more than $9,700 for that trip. And the list goes on and on. Last week, Mark Carney's health minister admitted that there are governance issues at Infoway. No kidding. The minister confirmed that the government is now withholding funding from the organization after Conservatives on the Health Committee exposed PrescribeIT, and I thank my colleagues for that. And days before that, the Liberal chair of the Health Committee warned Infoway that its failure to hand over the PrescribeIT document could see the organization found in the contempt of Parliament. You think about that. The organization tasked with advancing digital health in Canada, the so-called experts in managing health information electronically, could not produce documents when Parliament ordered them. If Infoway cannot handle a basic document request, Canadians are right to ask how it can be trusted with sensitive digital health data and the infrastructure of our country. And this is not a one-time mistake. The warning signs have been flashing before. A previous Auditor General report found that Infoway was misleading Canadians. It was reporting systems as available without disclosing that available did not mean used, adopted, or nationally compatible. This is a trick they have used for years. The people telling you that Canada Health Infoway is doing good work is Canada Health Infoway. And then they ask Canadians in Parliament to simply just take their word for it. It's not just Infoway's work that lacks scrutiny, it's the people doing it too. Infoway's Chief Financial Officer, David Fast, previously worked alongside dismissed CEO Michael Green at AGFA Healthcare North America before joining Infoway in 2024. We later found out that this was not a competitive staffing process, which raises serious questions about whether Infoway is operating on merit or whether insiders are helping themselves land highly paid taxpayer-funded positions. And even as the failures piled up, Infoway quietly locked taxpayers into $48 million of outsourcing contracts that run all the way to 2030. So while the minister talks about governance problems and withholding funds, the bills keep coming in and taxpayers are on the hook. How is all this allowed to happen so far out of the public eye? Because Infoway is not accountable to Parliament or Canadians. Despite living almost entirely off of your money, Infoway falls outside of the Access to Information Act. That means Canadians cannot request its records the way they can with government departments. It's not subject to the accountability that a minister has to answer for this in the House of Commons. Infoway enjoys all the funding of a government entity and none of the scrutiny. And let me be clear about something. Because the Liberals will try to make this about whether digital health matters, of course it matters. Nobody here is defending the fax machine. Infoway may have served its purpose when digital technology was limited and uncertain, but it has outlived its purpose. The question is not whether the work should be done. The question is who should do it and how Canadians can hold them accountable. If the work is worth doing, it should be done transparently inside of the government where the spending is on record and where the minister has to stand in the House to answer for it. If the work is so important, it should be not handed off to an unaccountable middleman that rewards failure and hides from scrutiny. Canadians deserve better than a government that confuses spending money with getting results. So here is what a Conservative government will do. First, we will end all federal funding to Canada Health Infoway. The era of rewarding failure and waste is over. Second, any function genuinely worth keeping will be brought inside Health Canada, where it is accountable to Parliament and where every dollar can be held more accountable. And third, we will respect the provinces. We will ensure proper coordination that respects provincial and territorial jurisdiction. The Liberals handed hundreds of millions of dollars to Canada Health Infoway and rewarded failure. The PrescribeIT scandal is proof of this. Conservatives will clean up the mess, we will protect taxpayers' dollars, and we will put patients ahead of insiders and consultants who got rich while Canadians waited for care. The money wasted on Canada Health Infoway would be far better spent on the doctors and nurses who actually take care of Canadians. Thank you, and I'm happy to take your questions.
Dan, did you get a response to your request for the AG to look into this?
We have not received a response yet.
Is there like a time limit on when the AG would have to respond? Or okay.
Not to my knowledge.
Given that we're likely a couple of years away from an election, unless you know something that I don't, rather than what a possible future Conservative government would do, what more do you think needs to be done right now to provide clarity on what happened here?
Well, Canada Health Infoway have submitted their documents. We did do a production order on that, and we're right now. It was kind of interesting. We were waiting on those documents. They had troubles getting past the password, believe it or not, and then it didn't come in all the formats, like 2 different official languages. So now our House of Commons is sifting through that, our clerk's office, and we're waiting on those documents. So.
And also, can I mention?
Yep.
We've repeatedly asked the minister to come into the committee and in front of Canadians and explain what's been happening for the last 10 years. And we have also repeatedly asked for Michael Green, the former CEO, who should be the expert on everything about PrescribeIT. We've asked him, we've requested him to come in, but all you're seeing, Canadians are seeing, are cameras turned off and basically what we speak about behind those behind closed doors, which Canadians aren't seeing, they will not be able to know what Liberals have said or we have said for 30 years. So that is something as Conservatives, we are doing everything we can. Just yesterday, we had a meeting that was originally scheduled that that was cancelled. And meetings have been adjourned. We're doing everything we can, and we're hoping that the Liberals will finally see the light and know that this information, $300 million, needs to come forward. The information of where it came from, where it's gone, and so follow our motion here, our idea that Infoway should be finished, and Parliament should have oversight for it.
The documents that you were able to get produced by the committee, was that production order put in place before the majority?
Yes.
Okay.
Yeah, we had, and it was interesting. I was asked the other day about like how come nothing's going on in committee? Like we're stalled, right? Everything goes back to when they had this manufacturer majority. We were actually coming for studies. We had we did a study on the impacts of immigration on the healthcare system, right? We exposed the $20 million, I think, on wasted pharmaceuticals for emergency use, right? Like all these things Conservatives were bringing forward, and the committee as a minority was really getting to some issues for Canadians. But that day they shut off the cameras, and then they started to just basically abuse their power.
Can I add just one thing to that?
Yep.
I think what's really important to point out is that at a press conference like this one, prior to getting the majority, Mark Harney said, the Prime Minister said, we need this majority because there's too many games happening at committee. And the moment he got his majority, that's when all these games started, with the adjournment of proceedings, with going in camera, with meetings being canceled, with documents being withheld. I think the Prime Minister lied to you on that day.
Good. Thank you.